Gallbladder ꯂꯧꯊꯣꯛꯈ꯭ꯔꯕ ꯃꯇꯨꯡꯗ ꯍꯥꯏꯗꯤ cholecystectomy operation ꯇꯧꯈ꯭ꯔꯕ ꯃꯇꯨꯡꯗ dietary changes खर maintain तौबा अमा दरकार लई digestion फजना maintain तौनबा and discomfort reduce तौनबा so सी video सिदा gallbladder remove तौग्रबा मीगी dietary recommendations सेमिनसी welcome back to the channel I am Dr. Nihar Sinam and after gallbladder removal diet change की मतंग दा 10 points सेमिनसी gallbladder सिना liver दगी थोलक पा bile से store तौर थमदुनी and अखोइना चाक चाबा मतमदा especially fatty food गुम्बा चाबा मतमदा gallbladder दो contract तौरगा हुजिकी bile juice तो intestine दा थादरोक्तोइनी so सिगी store तौरगा दरकार लेबा मतमदा थादरोक्नबा gallbladder से लेटरमनिना continuous rate दा liver दगी हुजिकी fluid तो juice तारा अनि bile जे so चक्सारा कांदा extra हुजिकी digestive enzymes यावबा bile से लापा खोटपदो अदुदो layer रोय so constant rate amda laani aduna digestion problems kumba yam chara kanda fatty food yam chara kanda aduguma digestion problem khal lerni so point number 1 kitang yam toina chagadaba haibadi amungtang da large meal chadoi saru haidi numi chupna thabak tawraga yam lame yam wari kainga amungtang da mayam chasan de saru gallbladder lokhrokhraba oirgadi nongmada manga tarurak oirasu kitang small amounts of chagadaba magi matamduda liver dagi tariba bile do adudana dum constant rate amada laani adudana digest tawa yanaba konanaba yam chaba matamda sai gallbladder na constrict taraga bile juice digestive enzymes yawu mayam thadorom godamdo adugi function do adugi system do laitramnina pick na toina chatam ani suba point high fat food reduce the watabadi haibadi fried food meat ki fatty parts natraga dairy products zu fat yam yauba milk zu fat yam yauba fat lokthokraba mong zu lei adumaina adugumba fat yam yauba mayam se reduce the watabadi for example french fries chaba pork capsule chaba chicken skin chaba so just examples ne of fried chicken chaba sigum myam je reduce tawta bani anything chaba kanda yai gai bake tawba grill tawba natruga steam tawba chinjak sina hina pharani point number 3 dietary fibers increase tawba adusu gradually yam thuna nataba so fiber rich food like vegetables fruits and whole grains kara sigumba kara hengat padaka lei hoigi bloating gumba natraga gas leiba khotpa handanaba si hengat pa jizu yam suddenly hengat pa noai tabani tam used to oraga hengakadaba point number 4 ising yam thakadaba well hydrated oigadaba digestion da zu mateng oinaba and constipation zu prevent tawnaba point number 5 gas producing food item reduce tawtamni for example cauliflower cabbage broccoli beans and koi cold drink thakpa like Pepsi Coca-Cola Sprite anything koi gas yawse sigumba se consume tawba handab tabni koi bloating nungsit ka khatpado gas production hingapado adu reduce tawnaba point number 6 spicy and acidic food reduce tawba spicy hadi mayam loin khangnare koi morok sabo oigera ndraga topa spices mayam yawba koi masala gum mayam yawba adu handabna phai and acidic food haizina for example koi tomatoes and citrus fruits say like lemon asin mayam se amla orange sigum se yamna high amount to consume to khara acidic orakani and koi digestive tract irritation tawgani and aduna kitang charagasu small amounts to chabna phai fruits ni haraga chumane am acidic oidaba fruits atai myam le adu fazana chabi ai point number 7 dairy sensitivity torpa yengba So gallbladder lꯧꯊꯣꯛꯈ꯭ꯔꯕ ꯃꯇꯨꯡꯗ ꯃꯤ ꯐꯅꯌꯥꯝ ꯑꯃ lactose intolerance develop ꯇꯧꯔꯛꯄ ꯌꯥꯎꯏ, lactose intolerance develop ꯇꯧꯔꯛꯄ ꯌꯥꯎꯏ ꯍꯥꯏꯕꯗꯤ ꯑꯩꯈꯣꯏꯒꯤ dairy productsꯇ lactose ꯌꯥꯎꯏ and ꯑꯗꯨꯅ ꯇꯨꯝꯕ ꯉꯝꯗꯕ digestion problem ꯂꯩꯕ ꯈꯣꯠꯄ ꯌꯥꯎꯏ. So lactose free products ꯑꯣꯏꯅ ꯊꯤꯕ ꯇꯥꯕꯅꯤ anything consume ꯇꯧꯕ ꯀꯥꯟꯗ. So ꯁꯤꯁꯦ ꯇꯧꯔꯛꯄ꯭ꯔꯥ ꯇꯧꯔꯛꯇꯕ꯭ꯔꯥ ꯍꯥꯏꯕꯗꯣ try ꯇꯧꯔꯒ ꯌꯦꯡꯕ ꯗꯔꯀꯥꯔ ꯑꯣꯏ. ꯁꯤ ꯍꯦꯛꯇ ꯇꯧꯔꯅꯤ ꯍꯥꯏꯕ ꯂꯩꯇꯦ, dairy product ꯁꯨꯡꯆꯥ ꯆꯥꯔꯣꯅ ꯍꯥꯏꯕ ꯅꯠꯇꯦ, but ꯁꯤꯁꯦ ꯇꯧꯒꯟꯕ ꯌꯥꯎꯏ. So ꯑꯗꯨ ꯆꯦꯛꯁꯤꯟꯕ ꯑꯃ ꯗꯔꯀꯥꯔ ꯑꯣꯏ. Point number 8, nicotine, caffeine and alcohol avoid tꯧꯕ ꯑꯃ ꯗꯔꯀꯥꯔ ꯑꯣꯏ. ꯁꯤ ꯃꯌꯥꯝꯁꯤꯅ digestive tract ꯁꯦ worsen ꯇꯧꯕ ꯌꯥꯏ and diarrhea ꯇꯧꯕ, bloating ꯇꯧꯕ ꯍꯦꯟꯒꯠꯄ ꯌꯥꯏ. So caffeine, alcohol and nicotine ꯁꯦ, so coffee, drinks and nicotine, smoking or ꯁꯤꯒꯨꯝꯕꯁꯦ ꯍꯟꯊꯕꯅ ꯐꯩ or totally avoid ꯇꯧꯕꯅ ꯍꯦꯟꯅ ꯐꯔꯅꯤ. Point number 9, ꯍꯥꯟꯅ ꯆꯥꯖꯔꯝꯕ ꯄꯥꯝꯖꯕ ꯑꯩꯅ ꯉꯁꯥꯏꯗꯒꯤ avoid ꯇꯧꯑꯣ ꯈꯣꯠꯂꯣ ꯍꯥꯏꯔꯤꯕ ꯃꯌꯥꯝꯁꯦ ꯁꯨꯝ ꯇꯝ ꯇꯝꯅ ꯈꯤꯇꯪ ꯈꯤꯇꯪ ꯇꯧꯔꯒ try ꯇꯧꯔꯒ ꯗꯥꯏꯠꯇ introduce ꯇꯧꯕ ꯌꯥꯏ, reintroduce ꯇꯧꯕ ꯌꯥꯏ. ꯍꯥꯏꯗꯤ ꯌꯥꯝ ꯐꯖꯅ ꯆꯦꯛꯁꯟꯅ low fat diet ꯆꯥꯔꯕ, high protein, lean protein and ꯍꯥꯏꯗꯤ chicken, fish ꯒꯨꯝꯕ ꯁꯤꯒꯨꯝꯕ ꯆꯥꯕ, ꯑꯗꯨꯁꯨ mostly steamed, grilled ꯁꯤꯒꯨꯝꯕ ꯁ꯭ꯇꯥꯏꯜꯗ ꯆꯥꯔꯕ, ꯑꯗꯨꯗꯒꯤ fruits ꯌꯥꯝ ꯆꯥꯕ, vegetables ꯌꯥꯝ ꯆꯥꯕ. So ꯁꯨꯃꯥꯏꯅ ꯆꯥꯔꯝꯃꯒ ꯇꯞ ꯇꯞꯅ ꯑꯇꯣꯞꯄ ꯀꯩꯀꯩ ꯆꯥꯅꯤꯡꯕ ꯂꯩꯔꯒꯁꯨ ꯇꯞꯅ ꯇꯞꯅ try ꯇꯧꯔꯒ ꯁꯤ ꯆꯥꯕ ꯀꯥꯟꯗ diarrhea ꯇꯧꯕ꯭ꯔꯥ, ꯁꯤ ꯆꯥꯕ ꯀꯥꯟꯗ irritating ꯑꯣꯏꯕ꯭ꯔꯥ, digestive tractꯇ bloating ꯇꯧꯕ꯭ꯔꯥ, gas production ꯍꯦꯟꯒꯠꯄ꯭ꯔꯥ, ꯁꯤ ꯃꯌꯥꯝꯁꯦ ꯌꯦꯡꯉꯒ ꯇꯨꯝꯕ ꯉꯝꯗꯕ꯭ꯔꯥ ꯈꯣꯠꯇꯕ꯭ꯔꯥ, ꯁꯤ ꯃꯌꯥꯝꯁꯦ ꯇꯞ ꯇꯞꯅ ꯌꯦꯡꯉꯒ diet ꯑꯅꯧ ꯑꯅꯧꯕ try ꯇꯧꯔꯒ reintroduce ꯇꯧꯕ ꯌꯥꯏ. Point number 10, probiotics consume ꯇꯧꯕ. ꯍꯥꯏꯗꯤ ꯑꯩꯈꯣꯏ ꯌꯣꯒꯔꯠꯇ ꯌꯥꯎꯕ probiotics ꯆꯥꯔꯁꯨ ꯌꯥꯏ, ꯅꯠꯇ꯭ꯔꯒ probiotic drinks ꯍꯥꯏꯅ ꯇꯣꯉꯥꯟꯅꯁꯨ ꯂꯥꯛꯏ, ꯅꯠꯇ꯭ꯔꯒ capsule or tablets ꯀꯤ ꯐꯣꯝꯗꯁꯨ probiotic available ꯑꯣꯏ. So probiotics ꯁꯤꯅ ꯑꯩꯈꯣꯏꯒꯤ digestionꯁꯦ help ꯇꯧꯏ. So probiotics ꯈꯔ consume ꯇꯧꯕꯅ ꯐꯅꯤꯅ ꯈꯜꯂꯦ gallbladder ꯂꯧꯊꯣꯛꯈ꯭ꯔꯕ ꯃꯤ ꯑꯣꯏꯔꯒꯗꯤ. So gallbladder ꯂꯧꯊꯣꯛꯈ꯭ꯔꯕ ꯃꯇꯨꯡꯗ ꯃꯤꯒꯤ ꯔꯦꯁꯄꯣꯟꯁꯁꯦ ꯇꯣꯉꯥꯜꯂꯤ. ꯐꯅꯌꯥꯝ ꯆꯥꯁꯟꯕꯗꯁꯨ ꯀꯩꯁꯨ ꯇꯧꯗꯕ ꯃꯤꯁꯨ ꯌꯥꯎꯔꯝꯕ ꯌꯥꯏ, and ꯈꯤꯇꯪ ꯍꯦꯛ ꯍꯦꯟꯅ ꯆꯥꯁꯟꯕꯗ, ꯈꯤꯇꯪ ꯍꯦꯛ oily food ꯆꯥꯁꯟꯕꯗ ꯌꯥꯝ ꯅꯨꯡꯉꯥꯏꯇꯕ ꯃꯤꯁꯨ ꯂꯩꯔꯝꯕ ꯌꯥꯏ. So ꯃꯁꯥ ꯃꯁꯥꯒꯤ ꯕꯣꯗꯤꯒꯤ ꯔꯦꯁꯄꯣꯟꯁꯇꯣ ꯆꯦꯛ ꯇꯧꯕ ꯑꯃ ꯗꯔꯀꯥꯔ ꯑꯣꯏ. ꯍꯣꯏ, ꯍꯧꯔꯛꯄꯗꯗꯤ ꯌꯥꯝ ꯐꯖꯅ ꯆꯦꯛꯁꯟꯅ ꯊꯥꯎ ꯌꯥꯝ ꯌꯥꯎꯗꯕꯤꯗ, ꯃꯁꯥꯂꯥ ꯌꯥꯝ ꯌꯥꯎꯗꯕꯤꯗ, ꯌꯥꯝ simple diet, small frequent low fat dietꯇꯩ ꯍꯧꯔꯒ sum try ꯇꯧꯕꯅ ꯐꯩ. And mi amagi yabado mi amada yadabi yai. And personalized diet plan ama darkar oiragadi dietitian gumba tanaraga fazana diet plan ama structure ama sembana phani. Thanks a lot for watching this video. Next video don't say bye.